Hello, Team Brandy. I am the 12th Suffolk State Rep, Brandy Fluker Oakley, and I am here because February is Heart Health Month. I know many of you have seen so many social media and newsletters and PSAs around this topic, but I thought it'd be really important to actually talk with an expert about the importance of heart health and what we can do to take care of ourselves. I'm so excited to have with me Dr. Nasrien Ibrahim of heart failure and transplant cardiologist. She's also the founder and executive director of the nonprofit, the Equity in Heart Transplant Project. So welcome me in spending time with her today. And Dr. Nasreen, please tell us, as we are ending Heart Month in February, why is it so important to pay attention to heart health?
The reason everybody needs to pay attention to heart health, not just in this month, but all year, is because heart disease is the number one killer of women and men. I think we spend a lot of time talking about cancer and cancer prevention, which is also really, really important. But the number one killer for the last several years of women and men in the United States is cardiovascular disease.
Wow. And what does that look like? You know, we hear cardiovascular disease. What are some of the types of diseases that relate to heart health not being optimal or ideal?
So heart attacks, heart failure, cardiovascular disease also includes strokes. But really, the gamut of heart disease includes everything from heart attacks to heart failure, all encompassing as the number one cause of death in the United States.
Wow. I didn't think I realized that coming into this conversation. And it's interesting because part of the reasons why I care deeply about heart health is given the fact of the way that I lost my grandmother. If you ever saw the movie Soul Food from back in the 90s, literally how Big Mama passed away is how my grandmother passed away. So she had diabetes and she had her leg amputated. Then she had a stroke and went into a coma, and then ultimately transitioned from this earth. And it's interesting because this was back when I was in eighth grade, and the day Tupac died is when my grandma died. So when everyone's mourning Tupac, I'm like, Grandma, RIP. And 6 months later, Soul Food came out. My mom and I are always big on supporting positive black movies in Hollywood. So I remember driving with her to the Braintree movie theater. We were sobbing because it was too soon after her passing, watching that movie. And I remember driving back home with my mom and asking her, Mommy, how do people get diabetes? And she told me it was related to sugar intake. And I kid you not, like 13 years old, I stopped drinking soda. I like disavowed sweets. I started to like turn off my penchant for dessert. So I still do a couple. And then fast forward, I was ultimately diagnosed as pre-diabetic. And I was so mad because I felt like I had tried my entire life since I was 13 to avoid being on this path. And it happens no matter how fit you look or how things appear on the outside, there's something happening on the inside. So for women, and especially black women, what are some of the indicators and what should we specifically look out for?
So I just want to say that especially for Black women, the statistics are really, really jarring. And so before I go into what we can do, I just want to make sure that we know the statistics in women. So cardiovascular disease kills 50,000 Black women every year. And almost 60% of Black women over the age of 19, so we're talking about women starting at the age of 20, almost 60% of them have cardiovascular disease. That is truly, truly shocking. These are numbers that were published recently by the American Heart Association. And even more shocking is that only about 40% of Black women know that chest pain could be a sign of a heart attack. And about 30%, only 30% know that neck pain, jaw pain, arm pain can also be a sign of a heart attack. And so also, the comorbidities, which are the things that predispose Black women to having heart disease, whether it's heart failure, heart attacks, even strokes, if we're talking about the gamut of cardiovascular disease, diabetes and hypertension and obesity, they're more prevalent in Black women. And so when we hear these statistics, we keep publishing them, we keep talking about them, but there's the need now is to what interventions are we going to take to reduce this risk? And so there's easy things that you can do. I think what becomes overwhelming is that we look at these lists and they're like, eat better, sleep better. reduce your stress, lose weight, control your sugar. But my advice to Black women is think of one thing every 3 months that you can change in your life that's going to reduce your risk of heart disease. So, sleeping. People underestimate sleeping, but healthy sleeping reduces your risk of heart disease. So we're talking about 7 to 9 hours of sleep a night. So maybe for the next 3 months, get an hour of sleep extra per night, and see how that changes your life. Reduce your stress. Do something that's going to reduce your stress. Think, not everybody likes meditation. Maybe working out reduces your stress, or prioritize your life in a way that you're getting rid of things that cause you stress unnecessarily, that increases your risk of heart disease. And then the other things like hypertension, high cholesterol, know what your blood sugar is. You need to know your numbers in order to to understand what you need to target to reduce your risk. But small changes over time make a huge impact.
Wow, that's really helpful. And I love that framing because I think, especially for women who are always on the go, Black women in particular, who I feel like we carry the world on our shoulders and then some as we try to navigate day to day. And then we hear the things we need to do. And so often it's like, when am I going to have time to do that? So I love your framing of every 3 months, pick a thing and try to make that thing a part of your lifestyle and who you are. When you hear from patients and other Black women and women of color who are like, I'm too busy. I just don't have time to kind of focus on myself in that regard. What's your response to that? And what are some things that they can do to support a healthy heart?
Okay, so my response is always you have to take care of yourself before you're able to take care of anybody else. You are the most important thing in your life. If you're not healthy, or if you're dying early at the age of 40 or 50 because of heart disease, then you're leaving people behind. And so you have to be your best self in order to be the best mother, the best partner, the best spouse, the best boss, the best state rep, the best senator. And so if you're not well, you're not able to do anything well, including being a parent, being a spouse. And so look at your life and look at the things that are causing you stress. Look at the things that are unnecessary and really just get rid of them, because the underlying cause of so many comorbidities that cause cardiovascular disease, like high blood pressure and obesity, all these things, really, the underlying commonality is this added stress that we see in Black women. Which is all the result of systemic racism. Everything comes down to systemic racism. And so I say you have to reframe your life. Yes, Black women and women of color love to take care of people, love to take care of others, love to nurture. But if you're not well, and if you're not living, the many, many years that we want you to live, you're not going to be able to do the things that you want to do and be there for your community. And so look at your schedule, look at the things that are not necessarily the board positions that are not paying you or contributing to your professional or personal development,
Hmm.
or the opportunities that are taking time away from things that you love doing. Maybe it's yoga, maybe it's going to concerts, all those things that reduce your stress. You need to be doing more of those and less of the things that are stressing you. And my advice is to look at the American Heart Association has this amazing thing called Life's Essential Eight. And it gives you these 8 domains that you can look at to reduce your risk of heart disease, including eating better. Number one, be more active, quit tobacco, sleep more, manage your weight, manage your cholesterol, manage your blood sugar, and then lower your blood pressure. And take one of those, like I said, every 3 months, because sometimes we get overwhelmed when we're trying to do too many things. Take one thing every 3 months and target it. Talk to your friends, build a community of girlfriends around you, and say, okay, I'm going to check in, make sure that you've gotten your cholesterol checked, and we're going to exchange numbers. And let's, make a goal of I want to reduce my numbers by 20% in the next 3 months. And so I feel like with this awareness, community efforts between our friends and the people around us that are important to us, we can reduce the risk, but it's just a matter of taking the necessary steps. Like even when we say about being more active, I tell my patients, literally walk 15 minutes one direction and 15 minutes back. That's all we're asking is 30 minutes of exercise a day, 5 days a week. And so when you break it down to just saying 15 minutes one way and 15 minutes back, it's more doable. And so I really, really, really want Black women to take better care of their hearts, because the things I see in clinic, the things I see in the hospital, it's just truly sad. And I'm now in my 40s, and so I'm seeing more of the women around me um, having high blood pressure. Their blood sugars are high, their cholesterol is high, and so I'm just more motivated to make sure the message comes out.
Oh, I appreciate that so very much. And we are so glad to have you fighting for us, especially in this important area. And as you mentioned, certainly exercise and diet play a role in our heart health. And I think about my mom, who is an Alabama girl through and through and has quite the appreciation for butter and oils and fat. When she herself experienced some hypertension a couple of decades ago, she truly had to revamp the way that she cooked some of her favorite Southern cuisines to make them taste good and also be healthy. For those of us who might have an affinity for foods that are on the unhealthy side, how can we balance good heart health with our favorite cuisines?
So I'm not the type of physician that says, you have to give up everything because that's not realistic. And if patients say they gave up everything, most of the time they're not being completely truthful. And so everything in moderation is okay. If you like to go out to eat, it's better to go out to eat once, maybe twice a week, not 7 days a week. I'm I'm not good at that, but eat out less, but also literally just go on Google and search for healthy Southern comfort food recipes. There's so many options and alternatives for different oils and things that can be used to replace the less healthy ingredients. But just look at life like everything should be in moderation because that red velvet cake or that sweet potato pie, I'm not going to say never have that, but just have less of it. If you know you're going to eat a big piece of carrot cake or red velvet cake, then maybe your lunch should be a salad and not pasta. And so everything in moderation because we have to enjoy life. We have to enjoy the foods in our cultures, but it's just you have to think of be creative in the recipes and the ingredients you're using in the recipes.
No, that's great. And I know that you have been a cardiologist for quite some time. I can't believe you're in your 40s when they say black and melanin does not crack. Like, let's talk, take a moment. You look good, girl. Tell me, what's the number one regret you often hear from your patients once they've experienced cardiac failure or are in need of a transplant?
Always say, "I wish I would have met you earlier." And
Mm,
so that means I wish I would have known my numbers. I wish I would have known that I was running around with hypertension for decades that was not controlled, that now resulted in end-stage heart failure, and now we're talking about transplant. Because I think that sometimes when, we get these diagnoses, a doctor or maybe a nurse practitioner tells you, you have high blood pressure, it's this anxiety and this fear of going on medications and wanting to not believe that you have high blood pressure and you're going to try everything, whether it's weight loss and exercise, which certainly help. But at some point, you have to go on medications if all those other lifestyle changes are not working. And the mistrust of the system and the healthcare system in general, which is not unfounded, but when you go years with uncontrolled hypertension, your heart is going to give up. At some point, your
mm.
heart's not going to be able to handle that amount of pressure that we're putting it under. And literally, uncontrolled hypertension for decades can end in heart failure, which might require a heart transplant. And so, a lot of times, it's, I wish I would have met you earlier. So, the regret is number one, maybe not knowing your numbers. So you're not going to get your annual physical. And so there's no way to know what your cholesterol is, what your blood pressure is, what your sugar is, because you're not necessarily going to know that I have high blood pressure. Not everybody has symptoms. And the second regret is not acting on the numbers. And so I think it's important to work with a clinician, whether it's a physician or a nurse practitioner or a physician assistant that you trust, that's willing to spend time with you, that's willing to explain to you why you need to be on certain medications. And if, again, if you feel like your doctor is not listening to you, find another one. But when we give recommendations, it's because we really and truly believe that, the meds are appropriate and that we need to get your blood pressure under control. And I just see it all the time. People in my age group running around with blood pressures in the 140s thinking the end result might not affect them. Even high blood pressure affects kidneys as well. So years and years of uncontrolled high blood pressure can result even in kidney failure and dialysis.
Wow. And just to hear the interconnectedness, right, that we might not even be thinking how our heart health impacts our kidneys and other functions of our body. I know you shared some resources already about the American Heart Association having those 8 habits, or I already forgot the title, so refresh us on the title. I remember the number 8. What are some other resources that we can check out and look to have a healthy heart?
So American Heart Association has Life's Essential 8, but American Heart Association has a lot of articles that are for the lay person. So they're written in a way that is digestible. American College of Cardiology also has lots of patient resources. And then the big healthcare systems, including Mass General Brigham, Mayo Clinic, Cleveland Clinic, they all have information that's easily digestible. And again, when you read, don't get overwhelmed. Just take a couple things that you want to work on in 2024 and make that your goal, and find a partner to hold you accountable for what you're going to work on for the next 3 months.
Okay, so I'm going to ask you publicly, will you be my accountability buddy over
Yes,
2024?
yes. What do you want to work on?
Okay, so I'd say Q1, I'm working on being more physically active in particular. So trying to exercise at least 3 or 4 times a week. And running has always been a great way for me to clear my head, but I haven't really ran since 2020. So just kind of getting back into that. And then sleep is the other thing that I know I need to get better at, because I really can't function if I have less than 7 hours of sleep. I'm not a happy camper whatsoever. So that'll probably be my Q2 goal. And then I'll look on the website for the Essential 8 to find out what you can hold me accountable for the remaining six
Okay,
months.
running. Do you run at a certain time of day? Because habits it works when you make something part of your daily life. So, like we brush our teeth every morning. Are you going to run at a certain time every week and a certain day of the week, or what are you going to do?
So my goal is to run every Monday, Wednesday, Friday, and Saturday. And if I miss Saturday because I might have an event or something for work, then to make sure I run on Sunday. I
Love it.
typically like to run early morning, but since we're still in daylight savings time, early morning is a little too dark for me. So I usually try to go between 7 and 8. Sometimes I'm a little earlier, sometimes I'm a little later. There was a couple times this past week when I had meetings at the top of the morning, so I actually did sunset runs. So I'm glad I still went. But what helps also make me want to run is I have like a little app where I can kind of track my runs and kind of see my progress. And the little app is so cute. She's like, "You're halfway there. You're doing great." So like literally as I'm running, getting like motivational inspiration to not quit midway through the run.
Reinforcement. We all need it. We all need it. No, I love that. I love it. So next time I see you, I'm going to ask how many times you went running.
Thank you. You are welcome to do that. And so is anyone else who sees me on the street. Please help me be accountable for my own heart health. And then, Dr. Ibrahim, I know that you're also the founder and executive director of a nonprofit. Can you tell us a bit more about your organization?
Absolutely. It's my life's work. So it's called the Equity and Heart Transplant Project, and we are a 501(c)(3) public charity, and we provide financial assistance to patients that have end-stage heart failure but just can't afford the out-of-pocket costs that are required for heart transplant. So a lot of people don't realize that, if your heart is super, super sick and you qualify for a heart transplant, you have to meet some other criteria, including having insurance coverage, being able to afford the copays, and for some people, housing. So if you live really, really far away from Mass General or Brigham or Tufts, we expect you to live within a certain mile radius, for example, after transplant. So some people can't afford to pay for housing back home, and then housing again in Boston. So we fill those financial gaps. We've helped with childcare. We've bought people insurance plans. We've paid for housing for anybody in the US to get a heart transplant. And the majority of people we've helped have been Black and Latinx. And that just tells you, again, the disparity with everything from who gets hypertension to who gets listed for heart transplant really affects racial and ethnic minority populations. And since September of 2022, we've helped 31 people in the United States get listed for a heart transplant.
Wow, that's incredible. That's incredible. And then, Dr. Ibrahim, can you talk a little bit about, so I am not a doctor, and I know, being a lawyer, people feel like they're a lawyer because of the TV shows they watch. And so I will admittedly say, yeah, I do a lot of medical TV shows. It does not make me a doctor, but I've seen episodes where there are disparities even in terms of what criteria is listed for people to get on the transplant list. And often I've heard that racial minorities are at a disadvantage because of the indicators. Can you tell us a little bit about that?
So that's where the psychosocial evaluations end up being the barriers to Black patients and Hispanic or Latinx patients getting listed. And what I mean by that is sometimes, the there it's called the wallet biopsy. So
Okay.
essentially, they look in your bank account and make sure that you have $10,000 in the bank account because that's the estimated out-of-pocket costs for 1 year after transplant. And if you don't have $10,000, we ask you to fundraise. And so, who does the wealth gap affect? It affects Black people in the U.S. And
Right.
so, there's other criteria for kidney transplant, for example. They've since rectified that Black patients were affected by a certain calculation for how bad their kidneys were in terms of whether they were going to get listed for a transplant, and they were less likely to get listed for a kidney transplant. And
Wow.
in terms of heart transplant, there's data that shows Black women are the most harshly judged when it comes to transplant selection. And the reason being, Black women are looked at like, do they have a partner that could be their caregiver? If they're going to get transplanted, then who's going to take care of the kids? So there's lots of just bias and lots of subjective, decision making that goes into who gets listed for a heart transplant. So yes, there's absolutely disparities based on our own biases and systemic racism that affect Black patients from getting enlisted for heart transplant.
Wow, I'm just like in awe and taking in all the wonderful information you're sharing. I'm like, it's Heart Health Month, it's Black History Month, and it's just like, this is why we're still doing the work that we do. I'm admiring your painting behind you, then I'm reflecting on the one behind me here, which is No Justice, No Peace, and they're also marching and have their own signs. But
I
it's like
love it.
we're still fighting fights that generations before us tried to fight in and eradicate. And just to hear this data and information statistics is
We
so
can't
fascinating.
stop, like it's exhausting, but we can't stop. And it's not our job to make people just feel comfortable. Like we have to call things out. And I always say, like, no matter what industry you're in, whether it's in education, whether you're a police officer, whether you're an elected official, whatever it is, you're an attorney, there's disparities in every aspect of America. Everything in America, um, you know, the underlying mechanisms of disparity are systemic racism. So, what are you going to do in the spaces that you're in the rooms that you're invited in, the tables that you're asked to sit at? What are you going to do to make a difference? And I went to this conference, and Ava DuVernay spoke, and she said, when you were on the court, did you move the ball forward? And so, what did you do when you were on this earth to just move the needle even one little tick closer towards justice? So I feel like it's everybody's responsibility in every industry to say, call stuff out, and do the work to make things better for the most vulnerable among us.
Oh my gosh. It reminds me of something my mom always tells me, even when I was a kid, which is leave things better than how you found them, right? So that's even if I step into a room or if I'm at camp or in the day to day of the job. And that's what I feel like from what you just shared. It's like, how are you going to leave this earth better than how you came into it and how you found it? Oh my gosh, Dr. Ibrahim, your nonprofit sounds amazing. How can people get involved? How can they support? Is there any way that they can get updates in terms of the work that you're doing? Please share with us.
So our website is the Equity and Heart Transplant Project.com. We have a big event. It's our inaugural gala in Boston on July 20th of this year. It's going to be huge, 300 people. We're going to have lots of entertainment, open bar, food, and all for a good cause. So information on that will also be on our website, but you can also follow me. All my social media is Dr. Nasrien, so DrNasrien.
Wonderful. And is there anything else we should know about heart health or that you'd like to share with us?
It's the number one killer. Know your numbers and do the work to reduce your risk.
Dr. Nasreen Ibrahim, thank you so much. Looking lovely in our sororities pink. I wore intensified pink for Heart Health Month today for our
I saw
interview.
the
But
colors behind you. I said pink and green. I'm gonna forgive you for the red. You have pink and green
I did
behind
it
you.
for Heart Health Month. My loyalty is not divided. I know where I stand.
I know.
Thank you so very much for your time. All of Dr. Nazarine's contact information, meaning her social media handles and the link to her website, will be in the caption. So please do check it out, support her work, and thank you again for your time and taking the moment to share with us, given your busy schedule.
Thank you for having me.